Hello guys, welcome back. In this video, I am going to describe about the ectopic pregnancy versus corpus luteal cyst. So this is very necessary to identify ectopic pregnancy and corpus luteal cyst because ectopic pregnancy is a very emergency condition, whereas the corpus luteal cyst is a physiological cyst. It does not cause any fatal emergency, whereas the ectopic pregnancy is a life-threatening condition. So let's begin with the what is ectopic pregnancy. Ectopic pregnancy is the implantation of zygote or embryo outside the uterus. So most common site is the tube, that is the ampullary isthmus or fimria. Then interstitial at the junction point of the tube and the uterus, we can see here. And then ovarian or cervical, and in case of the post-operated or post-LSCS, that is the scar ectopic pregnancy. So most common site is the tube. Now next is the corpus luteal cyst. So what is corpus luteal cyst? It is the physiological cyst, that is the ruptured follicle forming cyst. Most common location of the corpus luteal cyst is the ovary. So it is intra-ovarian. So how we differentiate the ovarian ectopic from the corpus luteal cyst? So very less frequency of the ectopic, ovarian ectopic seen. It is 0.5 to 1% only, whereas the corpus luteal cyst is mostly or exclusively seen in the ovary. So let's see differentiating point in ultrasound. We can see differences in these two images. This is the ectopic pregnancy and second one is this larger one is the corpus luteal cyst. We can see there is a echogenic rim in ectopic pregnancy. This is called the decidual reaction, whereas rim is isoechoic in corpus luteal cyst. So this is a very important differentiating point, that is the echogenic rim of ectopic pregnancy and isoechoic rim of corpus luteal cyst. And yolk sac also visualized in ectopic pregnancy, but if not visualized, then this echogenic rim is the differentiating point. Next differentiating point is the tubal ring sign or Bagel sign or blob sign, as we can see here. So in case of ruptured ectopic pregnancy, we can see that the very thick walled complex cystic lesion in Adnexal, and in corpus luteal cyst, internal debris or retracted clot can be seen. So these are the differentiating point. There is a ring of fire sign commonly known for the vascularity around the cyst. This is most commonly seen in the corpus luteal cyst, whereas this is also seen in the ectopic pregnancy. So this is not specific for corpus luteal or ectopic pregnancy, but it can be seen in both, but more common in corpus luteal cyst, that is the vascularity around the cyst, and it can be seen in color Doppler or power Doppler study. So this is seen in both condition, but more specific for the corpus luteal cyst. Let's summarize the differentiating point of ectopic pregnancy and corpus luteal cyst. So first, ectopic pregnancy, what we see first, empty uterine cavity with positive UPT. This could be weakly positive UPT or serum β-hCG positive. Tubal ring sign, as we have seen in image, Bagels or blob sign, ring of fire sign. Complex adnexal or tubal lesion can also be seen in the case of ruptured ectopic, and the pseudo-gestational sac or decidual cyst can be seen in uterus in case of the ectopic pregnancy. Whereas in corpus luteal cyst, well-defined cyst seen in ovary with low-level internal echoes. There is no tubal ring sign, but ring of fire sign can be seen in corpus luteal cyst, or this is more specific for the corpus luteal cyst. So there is no complex tubal lesion and uterine cavity is empty, or true gestational sac can be seen in case of corpus luteal cyst. If it is associated with pregnancy, then it is called the theca luteal cyst. Most important point is the UPT or serum β-hCG is negative in case of the corpus luteal cyst without true pregnancy.